Good morning, everyone. Welcome back to our YouTube channel, Dentizy. Let's make dentistry easy with Dentizy. So today we are going to discuss about GUMPADS, the GUMPAD occlusion. So let's get started. So as we all know, while discussing the development of occlusion, it has been divided into certain set of periods. One is called as the GUMPAD occlusion, the deciduous dentition, the mixed dentition period, and the permanent dentition period. In this particular video, we'll describe about the GUMPAD occlusion specifically. So basically, GUMPADs, these are nothing but the alveolar processes at the time of birth. So those are called as the GUMPADs. These are firm, pink, horseshoe shaped. They are covered by the dense layer of the fibrous periosteum. Now, why this is called as the pre-dentate period or the predental period? Because the gum pads are present before the teeth erupts into the oral cavity. As we all know, the deciduous tooth, they start erupting into the oral cavity at the age of 6 months. So before that, from the time period, from the birth till when no teeth are present in the oral cavity, that particular period is called as the gum pad occlusion or the predental period. If we look at the diagram, this is the maxillary gum pad. In this case, we are basically, if you look at the shape, it looks like the horseshoe shape. Hence, that is why it's called as a horseshoe shape. It resembles that shape. This is firm, this is pink, and it develops in two portions. This is the lip area, hence that's called as the labial. This is the buccal area, hence this is called as the buccal portion. One is the labiobuccal portion, and another one, in this case it's palatal, otherwise it's called as the lingual portion. So it develops into the two portion, and both the portions of the gum pads, they are being separated from each other with a groove which is called as the dental groove. The gum pads, they are divided into the certain segments with the grooves, These particularly grooves are called as the transverse grooves. Now, there is an important thing to remember here is, as we know, the transverse grooves, it divides the alveolar processes or the gum pads into certain set of segments, beneath which there is the deciduous tooth sacs are present, which leads to the formation and the eruption of the deciduous teeth. Now here important thing to remember is the presence of lateral sulcus. Now why this lateral sulcus is important? The transverse groove which is present between the canine and the first deciduous molar, there the transverse groove is called as the lateral sulcus on both the sides. This is canine and the first molar. Here the transverse groove will be named as lateral sulcus. Now the question may arise that what is the importance of this lateral sulcus? If we look at the diagram, If we look at this diagram, as we can see, this is the maxillary arch and this is the mandibular arch. The maxillary arch is wider and longer as compared to the lower arch. This is the upper arch, green one, this is the lower arch. And when they are proximated on each other, there is a complete overjet between both the upper and the lower arches. That lateral sulcus, particularly, it helps in determining the inter-arch relationship at a very early age. So that determination of inter-arch relationship at the early age is being judged with the presence of lateral sulcus, and that is why it is very important. As we have seen earlier about the lower arch also, this is less wider as compared to the upper one. When both the arches are approximated, there's a complete overjet, and the area of contact here is the first molar region. The area where they both are connected or in contact with each other is the first molar region. In this diagram, you can see that there is one anterior portion, another one is the posterior portion. In this case, there is anteriorly there is the open bite when the areas are being proximated between the upper and the lower arch. This area is called as the infantile open bite. This is the normal phenomenon. This is the normal phenomenon as in case of developing dentition. This infantile open bite, this plays a very important role during the breastfeeding. When a mother breastfeed the child, then this helps in the phenomenon called as the suckling, in which the orofacial musculature is involved. It helps in the growth and development of the child as well. Since this infantile open bite, it corrects itself on its own as the age advances. So that is why this is also called as the transient malocclusion. Transient malocclusion. So students, this was all about GUMPAD occlusion, the basic ones. Please like, share and subscribe and stay tuned to our YouTube channel. Take care. Stay tuned.